Why does neck pain never seem to go away? And what you're about to hear might just change everything. Hi there, I'm Dr. Ethan Greenwell. I'm 60 years old and have spent nearly 40 years working in public health. Over those decades, I've seen thousands of patients from all walks of life, all ages. But there's one strange thing I just can't ignore. So many people live with chronic neck pain without ever really knowing why. One patient once told me, "Doctor, I just want to turn my head when I drive without feeling like a knife's stabbing me." That one sentence stuck with me for years. Most people think it's just age or bad posture. Sure, those are part of it, but they're only the tip of the iceberg. The truth is, and this is what you really need to know, there are a few tiny muscles that are often completely overlooked in most treatment programs. But they're the real reason your neck pain keeps coming back. According to a study published in the Journal of Orthopedic and Sports Physical Therapy, over 80% of chronic neck pain cases are linked to tightness or imbalance in muscles, like the scalenes, levator scapulae, rhomboids, or sternocleidomastoid. Names you've probably never even heard mentioned at a doctor's office. Did you know when you tilt your head forward just 30 degrees to look at your phone, the pressure on your neck increases by 4 times. That's 40 to 50 pounds, like wearing a backpack full of bricks, strapped right to your neck. And most of us do that for hours every day, year after year. The sad part, so many people stop at painkillers, heat pads, or neck braces. They treat the symptoms but never address the root mechanical cause. That's why I made this video, not to offer quick hacks or miracle cures. I want to give you something better, a deeper understanding of your own body. You're going to learn which hidden muscles are secretly putting pressure on your neck, how to test them yourself right at home with no equipment, and most importantly, how to release them safely, scientifically, and for the long haul. Stick with me till the end, because I'll walk you through a 7-day plan to ease your neck pain, no clinic required, because I truly believe your neck deserves to move freely. And you deserve to live with ease, not limited by pain. Let's get started. Why your neck hurts. The real cause isn't what you think. You know, the human body is kind of like an old house. The creaking sounds never come from where you expect. You think it's the roof making noise, but really it's a crooked hinge on the back door. Neck pain is a lot like that. It doesn't hit you suddenly like a fall or a sharp injury. It creeps in slowly, silently. And by the time you notice it, it's already woven itself into your everyday life. I had a patient once, Susan, 58 years old, a retired school teacher. She said to me, "Dr. Ethan, I can't even remember when the pain started. I just know that now, every time my grandkid calls me, I have to turn my whole body like a robot to look at him." We tend to think neck pain is from a bad pillow, poor posture, or sitting at a desk too long. And yes, those things do play a role, but they're not the root cause. The real reason is this. We've quietly accumulated thousands of tiny violations against our own body over years, even decades. Sitting too long without moving, staring down at our phones for hours a day, never stretching, never really resting. And muscles like the scalenes or levator scapula, the silent gatekeepers, start to tighten, stiffen. Not because you exercised wrong, but simply because you forgot they existed. I want to ask you something. What have I done to my body over the past 10 years? And have I really been listening to it? We take care of everything, the house, the kids, the bills, but we forget to care for the one thing we truly own, this body. And the neck, the bridge between your brain and the rest of you, is often the most neglected part of all. One little lesson I've learned after all these years: the body always whispers before it starts to scream. If your neck feels sore today, chances are 2 years ago it already whispered, "Hey, I could use a little stretch." But you were busy. We're all busy. And that's okay. Because the good news is the body remembers and it forgives. You just have to start again, today. So how do you figure out which muscle is actually holding all that tension and pain? In the next part, I'll walk you through a map of your body, where the forgotten muscles are quietly waiting for you to notice them again. Let's keep going. Muscle map. Anatomy behind the pain. If you've ever tried fixing an old watch, you'll know this, and to get it ticking again, you can't just look at the dial and twist the knob. You have to open it up, see how each gear fits together inside. The human body is the same way. If you want to truly solve your neck pain, you have to understand what's going on inside your neck and which gears are stuck. At first glance, the neck seems simple, just a bridge between your head and shoulders. But in reality, it's a crossroads of over 20 muscles, nerves, blood vessels, and delicate vertebrae. Every time you tilt your head to read or turn to answer someone calling you, dozens of muscles are working together like a symphony. And when one instrument in that orchestra is out of tune, you feel it. I remember a patient, Alan, 64, a cheerful guy who loved fishing and golf. But lately he stopped going out. Not because he was weak, but because every time he cast his fishing line, a sharp pain shot from his neck to his shoulder, stopping him cold. After checking him, I found the levator scapula, a small muscle running from the side of the neck down to the shoulder blade, had tightened up severely. Every time he lifted his shoulder or turned his head, that muscle stretched like a rusted guitar string. And the surprising thing, he didn't even know that muscle existed. Funny, isn't it? Sometimes the parts of us we don't even know are there are the ones that speak the loudest when they're in pain. The map of our body isn't just some dry anatomy diagram. It's a map of movement memories where every step, every glance, every shrug leaves a mark. And when we ignore those small muscles for too long, they start to speak up through discomfort. So I want you to take a closer look with me at 5 key muscles on this neck map. Trapezius, the big triangle-shaped muscle draped over your shoulders where stress loves to collect by the end of the day. Levator scapulae, the pulley that lifts your shoulder blade, often overused when you hold your phone between your ear and shoulder. Scalenes, small muscles on the side of the neck, and when they tighten, they can press on nerves and cause tingling. Sternocleidomastoid SCM, the muscle that rotates your head, often shortened from hours of screen time. Rhomboids, muscles between your shoulder blades, key for keeping your posture stable. Let me ask you this. If you understood your body better, would you live differently? One little lesson I've learned over the years. Understanding is the first step to healing. Not fancy tools, not medication, just knowledge about yourself right down to the tiniest fibers. And now that you've got the map in your hands, it's time we go deeper. How can you tell which muscle is causing the pain? Where exactly is that discomfort coming from? In the next section, we'll explore that by learning how to listen to the quiet signals your body has been trying to whisper to you all along. The top 5 overlooked muscles that trigger neck pain. You know, when we're young, we usually think pain comes from the big stuff, a fall, an accident, a tough gym workout. But once we pass 50, we start to realize it's the small, repeated motions that quietly wear down our body, like bending your head to read the paper, or tilting your neck to hold the phone while your hands are washing dishes, or even just sitting a little crooked every night while watching TV. Those things seem harmless, and they are, until they've been repeated for 10, 20 years. Eventually, every muscle speaks up. I once had a patient, Charles, 67, a long-haul truck driver. He had a straight posture, broad shoulders, a tough presence. But when I asked him to raise his right arm to scratch the back of his neck, he winced, leaned forward, eyes squinting from the pain. "Doc," he said, "I just figured this pain came with getting old." "No," I told him. "It came from forgetting the quiet friends, the muscles we overlook." So let me introduce you to 5 of those silent heroes, the real characters behind your neck pain. 1. Sternocleidomastoid. It's complex, but you know it well. You use this muscle every time you nod or tilt your head up. It's the quiet victim of all that phone scrolling, and over time it shortens without you noticing. 2. Levator scapulae. This one runs deeper, connecting your neck to your shoulder blade. Ever feel a sharp pull in your neck when turning your head in the morning? That's this guy talking. It's especially sensitive to lopsided postures like working on a laptop off to the side. 3. Trapezius. This is the gatekeeper of your neck and shoulders. When you're stressed, overthinking, or stuck at your desk all day, this muscle takes the first hit. That heavy, achy feeling in your shoulders by evening, that's the trapezius waving a red flag. 4. Rhomboids. Nestled between your shoulder blades, the rhomboids help keep your back straight and chest open. If you feel soreness in the middle upper back, especially after long sits or deep breaths, this might be the culprit. 5. Scaleness. These are 3 small muscles on the sides of your neck. Most people never notice them, but they're closely connected to the nerves running down your arms. When tight, they can cause tingling, heaviness, or weakness in your arms, often mistaken for just aging. Do any of these muscles sound familiar? Are they silently part of your daily discomfort? Here's a small lesson I've learned. The body never hurts without reason. It just doesn't know how to speak except through pain. But if you learn to listen, you'll know what to do next. In the next section, I'll show you the everyday mistakes these muscles endure, from posture habits to unconscious routines. And more importantly, how to stop repeating them so your neck can finally feel free again. Let's keep going together. Mistakes you're making every day that tighten these muscles. Some mistakes in life, we know the moment we make them. But others, they go on for years, quietly, repeated daily. And we only realize them when our body finally speaks up. I often tell my patients, pain isn't your enemy. It's a letter from your body, you just rarely open it to read. You know, most of the neck pain cases I treat aren't from injuries or dramatic movements. They come from habits that seem harmless, things you and I might be doing right now. I remember Martha, 62, a wonderful homemaker with a kitchen that always smelled like fresh pie. But she constantly struggled with neck and shoulder pain. Each morning she winced when turning to grab ingredients from the kitchen shelf. The reason? For over 30 years, she had a habit of tilting her head to hold the phone between her ear and shoulder while rinsing vegetables and chatting with her daughter. Her levator scapula and SCM muscles had shortened bit by bit, silently, without warning. So what are these everyday mistakes? Looking down for too long, using your phone, reading, or watching your iPad with your head tilted down. Even a 15 to 20 degree tilt adds dozens of pounds of pressure to your neck. Repeat that for 3 to 5 hours a day over 10 years, and your neck will start pushing back. Not changing posture often enough. Humans weren't built to stay frozen. Yet we often lock ourselves in one position for hours, watching TV, working at a desk, or driving. That leaves muscles like the trapezius and rhomboids working overtime without a break. Using the wrong pillow. Sleep is supposed to be recovery time. But if your pillow is too high or too soft, your head is held at a bad angle all night, keeping neck muscles tight for 6 to 8 hours straight. Improper desk setup. A desk that's too low or a monitor that's not eye level forces you to constantly lean or crane your neck forward. This turtleneck posture quietly strains your scalenes and trapezius every single day. Do any of these sound familiar? If so, don't feel guilty. We can't blame ourselves for things we were never taught. Here's a little lesson I've learned. Sometimes healing doesn't require adding anything new, just removing a few old habits. Sit a little less. Look down a little less. And remember to care for yourself while you're busy caring for everyone else. Now that we've uncovered some of these silent mistakes, the next step is tuning in, learning to listen to which muscle is speaking up. Each one has its own way of sending signals, and the good news is you can learn how to read them with a few simple at-home tests. That's what we'll do in the next part. No equipment, no doctors, just you and a little bit of listening. Ready? Let's keep going. Test yourself which muscle is causing your pain. Your body always knows before your mind catches up. Long before pain keeps you up at night, your body's been whispering with tiny signals. But maybe you were busy. Maybe you never learned how to listen. Today, I want to invite you to try something new, or maybe something ancient. Something humans have always done, listening to yourself. No machines, no fancy diagnosis, just a mirror, a chair, and a few quiet minutes. I remember one Monday morning, Lorraine, 70 years old, walked into my clinic with a little notebook in hand. "Doctor," she said, "I wrote down every movement that hurts, but I still don't know what's wrong." I smiled. "You don't have to guess. Let your body tell you." And so we began with some simple tests. Test number 1. Trapezius. Upper back muscle. Sit up tall. Place your left hand behind your back. Now use your right hand to gently pull your head to the right, as if bringing your ear to your shoulder. Where do you feel it? If the stretch pulls from your neck down to your shoulder, your left trapezius might be tight. If there's a sharp pinpoint of pain, like a needle, that's likely an active trigger point. Test number 2. Levator scapulae. Left hand behind your back again. Now tilt your chin down and to the right, like you're nodding towards someone standing behind your right shoulder. Feel a deep pull at the back of your neck, or a sharp ache down toward your shoulder blade. That's your levator scapula speaking up. Test number 3. Scalens sit still. Gently tilt your head to the right and lean it slightly back. Do you feel a pull along the side of your neck, near your collarbone? Maybe even a bit of tingling down your arm? That's your scalens, and they might be compressing a nerve. Test number 4. Sternocleidomastoid. SCM. Place 2 fingers just below your ear, right where your neck bulges a little when you turn your head. Now slowly nod. Feel that tight cord-like muscle pop up. If it's sore or stiff, your SCM could be shortened, likely from spending too much time looking down at screens. Test number 5. Rhomboids. Sit in a chair. Hug yourself. Arms crossed, hands on opposite shoulders. Now push your elbows forward like you're holding a big beach ball. Feel that tension between your shoulder blades, maybe even a dull ache in your upper back. Your rhomboids might be overstretched and overworked from poor posture. You see, pain isn't vague anymore. It has a place, a pattern, a voice. And when you learn how to listen, you begin the journey toward healing. One lesson I always remind my patients: your body doesn't need perfection. It just needs you to return to notice, to gently explore, and to be patient. Now that you know which muscle is crying out, it's time for the next step. In the next part, I'll guide you through specific exercises, step by step, to release these exact muscles. No random stretching, no guesswork, just real targeted relief. Are you ready? Let's get into the practice. Release technique number 1. Active stretching that actually works. Someone once asked me, "Dr. Ethan, I stretch every week, so why does my neck still hurt?" I smiled and said, "Stretching isn't wrong, but how you stretch, that's what makes all the difference." Just like in life, sometimes it's not about letting go completely, but about releasing with intention. Your muscles are no different. They don't just need to be pulled, they need to be properly activated before being stretched. I call it active stretching, a way of moving your body with awareness, not just pulling, holding, and hoping. Think of trying to open an old wooden door that's stuck. You don't just yank it. You nudge it, wiggle it, press a little, and then ease it open. Muscles respond the same way. They need to be gently woken up before you ask them to stretch. Let me show you a simple, powerful technique I used with Eleanor, a 66-year-old pianist who had to stop playing because of chronic neck and shoulder pain. We started with her trapezius, the big muscle that takes the hit every time you worry, overthink, or sit too long. Active stretch for the trapezius. Sit or stand tall. Place your left hand behind your back. Rest your right hand gently on your head and pull your head toward your right shoulder like you're trying to rest your ear there. Stop at that good stretch point, not pain, just a deep pull. Hold for 5 seconds. Now push your head gently upward, as if trying to escape the hand. Just 20–30% effort. Hold for 5–7 seconds. Release and stretch again a little deeper. Feel that new range. Repeat 3 rounds on each side. No rush. Slow breathing. Let your body open inch by inch. You can do the same technique with other muscles. Stretch, then gently resist. For levator scapulae, tilt your head away from the tight side, then rotate your chin down toward your opposite shoulder. Add gentle hand resistance, then release. For SCM, hold your collarbone with one hand. Tilt and rotate your head with the other. Add a bit of resistance, then let go slowly. What do you feel during your first try? A gentle tingling. A wave of warmth, that quiet relief like the end of a long sigh. That's a good sign. Your body's opening up. And here's a small truth I want you to carry with you. Healing doesn't come from force, it comes from collaboration. Between you and your own body. You don't need to stretch deeper. You just need to stretch smarter with direction, rhythm, and patience. In the next section, I'll show you another incredibly helpful technique: how to massage tight spots using your hands or just a tennis ball. Simple, free, and it might just change how you sleep tonight. Let's keep moving forward together. Your neck deserves that feeling of lightness again. Release technique number 2. Trigger point. Massage at home. You know, some days, we just wish someone would gently place a hand on our shoulder and say, "Hey, you can stop holding it all in. Just relax." But when there's no one around to say that, I want you to know you can do that for yourself. The human body is a curious thing. It stores emotions in every fiber of muscle. A rushed bend to pick something up. A month of restless, shallow sleep. A year hunched over a laptop without moving. Those moments don't pass unnoticed. They leave behind what we call trigger points. Tight little knots of tension buried deep in the muscles. You can't see them, but oh, you can feel them. It's that strange pain when you press one small spot and it hurts more than anywhere else, like someone poking a bruise you didn't know you had. I once taught Mr. Paul, 71, a retired gardener, how to massage his rhomboid muscles. For 3 years, he thought his upper back pain was from spinal degeneration. But just 1 week of proper trigger point release later, he told me, for the first time in years, I slept through the night without waking up from pain. So how can you do trigger point massage at home? You don't need anything fancy, just a tennis ball, a wall, or the floor. Step 1. Find the painful spot. Use your fingers to gently press around your neck, shoulders, and upper back. When you find the spot, you'll know it's a strange, hurts so good feeling, like tension finally being acknowledged. Step 2. Apply steady pressure. Lean your body into the tennis ball placed between you and the wall, or lie on the floor. Roll slowly. When you hit the spot, pause. Take a deep breath. Hold for 20 to 30 seconds. Step 3. Small movements. Deep breaths. You don't need to roll hard or fast. Sometimes just being still and breathing is enough to soften those tight spots, like soil loosening after the rain. Time just 2-3 minutes per area. No need to push hard. Don't massage when your body's cold. So what might you feel after your first session? A sense of lightness. Maybe a warm, soothing sensation. Or even a gentle wave of sleepiness. That's a good sign. It means your body is letting go. It's open to healing. And here's a truth I deeply believe. Taking care of yourself isn't selfish. It's one of the greatest gifts you can give to your own life. No one else can live your life for you. And no one can release these knots quite like your own 2 hands, when guided with care and patience. And when those knots begin to loosen, it's time to give your body something even more powerful. Not just relief, but prevention. In the next part, I'll walk you through how to set up a workspace and home environment that supports your neck, shoulders, and spine so you can keep this comfort going. Let's keep walking together, because we don't just want to be pain-free. We want to feel fully alive again. How to set up your workstation to prevent recurrence. There's something I've always cherished in the medical field: helping patients not just heal, but stay healed. Getting out of pain is wonderful, but staying free, being able to move without fear, that's the real gift. I remember once visiting my old patient, Fred, 68 years old, living in the quiet suburbs of Oregon. He invited me over for tea, smiling proudly, saying, "Doc, it's been 3 months, no neck pain." But as I stepped into his little home office, I raised an eyebrow. His monitor was tilted far to the right. His chair had sunk too low, pulling his shoulders forward. No footrest. The keyboard way too high. I didn't need to examine him. I knew if nothing changed, the pain would return. Quiet and persistent, like a drizzle in early spring. The way you sit every day can be your medicine or your poison. And the good news, setting up a neck-friendly workstation isn't complicated at all. Golden rule number 1. Screen at eye level. Your monitor should meet your gaze, not looking down, not craning up. Think of your eyes like a calm lake. Your screen should float right in front, not above, not below. Golden rule number 2. Your chair should lift you up, not sink you down. Pick a chair with good back support. Adjust the height so both feet touch the floor. Your thighs should be parallel to the ground. If your chair is too low, your neck leans forward often without you even realizing it. Golden rule number 3. Keyboard. Close elbows at 90 degrees. You shouldn't reach for your keyboard. Your arms should feel like you're sipping tea, not stretching for a handshake. Golden rule number 4. Break every 30-45 minutes. No matter how perfect your setup is, sitting too long is the real enemy. Stand up, take a few steps, stretch, roll your shoulders. I always tell my patients, set a gentle reminder not to work, but to rest. Now, are you sitting properly right now? Pause the video. Take a quick look around your desk. Maybe all you need is to lift your screen with a book, or slide your chair just a bit. Small changes done consistently create big results over time. And here's a little lesson Fred once told me that stuck with me. When I changed how I sat, I changed how I lived. I don't bow my head as much anymore, not just in posture, but in spirit. And now that you've healed, learned how to prevent, the next step is to maintain, gently, daily, like tending to a quiet little orchid on your windowsill. In the next part, I want to share a real recovery story, a journey from long-term pain to freedom of movement. So you can see that yes, this is possible. And more importantly, you deserve it. Let's keep going. Case study from pain to freedom. The real story of a desk worker. You know, I've seen so many people with the same story, just different names and jobs. But the pain, it's surprisingly familiar. Let me introduce you to Jeremy, 56 years old, an administrative staff at a small college in Colorado. He's not an athlete, and he never had a major injury. He simply sat at his desk for 9 hours a day, every day for 20 years. When Jeremy came to see me, it wasn't because of some dramatic pain. He said, "Doctor, I can't turn my head when driving. And every morning I feel like my neck is completely locked." That wasn't the kind of pain that makes you scream. It was the kind that slows you down, not because you want to, but because you can't do anything else. We started with small changes, checked his posture, taught him active stretches, especially for the trapezius and levator scapulae, showed him how to use a tennis ball to massage tight spots. And the most important part, a gentle daily routine, just 10 minutes every morning. In week 1, Jeremy said he felt nothing monumental. By week 2, he started sleeping better. By week 4, he called me just to say he backed his car out of the driveway without having to twist his whole body. For him, that wasn't just a movement. That was a return to freedom. Have you ever considered that something as simple as turning your head might just symbolize the return of freedom? Jeremy didn't transform his life with some miracle method. He just was consistent with small acts repeated with care every single day. And that's the lesson I hope you carry with you. Healing doesn't come from big leaps. It comes from small, steady steps taken with kindness toward yourself. If you're in the place Jeremy was, please don't lose hope. Don't say I'm too old or think is it too late to change. It's never too late. Because every day without pain is a day worth living. Now I want to give you a gift, a 7-day plan, simple, clear, and doable at home so you can start your own journey toward recovery just like Jeremy did. Let's walk that final stretch together, where learning becomes doing. Are you ready? Let's take the next step. Recap and action plan. Your 7-day neck relief blueprint. We've come quite a long way together, haven't we? From understanding why your neck hurts to uncovering the hidden muscles, learning how to test, stretch, massage, and change habits. step by step, gently, patiently. Like nature healing a dried-up tree, not in a rush, but with steady intention. So now I'd like you to pause for just a moment and ask yourself, what does my body truly need right now? Maybe it's to be heard, maybe a gentle movement, or maybe just a quiet promise I'm going to take care of you starting today. And to make it simple, I'm giving you a gift, a 7-day neck healing plan that's easy, clear, and truly effective. Day 1, 2. Awareness and listening. Do the basic muscle tests you learned earlier. Write it down. Where does it hurt? Does the pain move? When does the tension peak? Spend 10 minutes each evening simply sitting still and noticing your neck. No fixing, just noticing. Like a first date between you and your body, just reconnecting. Day 3, 4. Activate and gently stretch. Do the active stretches for the muscle groups you identified. Focus on breathing. Don't force it, stretch with kindness. Repeat each stretch 3-4 times, 5-10 minutes total. If you can add a morning session, it's a beautiful way to start the day. Day 5-6, release the silent tension. Use a tennis ball or your fingers for gentle trigger point massage. Hold each spot for 30 seconds, breathe slowly, no pressing hard. Focus especially on the back of the neck, between the shoulder blades and under the ears. This is where you'll start releasing knots you've carried for years, often without even knowing. Day 7, reset your space, reset your life. Adjust your workstation, screen, chair, desk, just like we talked about. Set gentle reminders to stand every 45 minutes. Create a small corners in your home just for stretching, breathing, being still. And if you can journal your 6-day journey, what did you learn? How has your body changed? You may not get everything perfect. That's okay. You showed up. And to me, that's already a gift. One final lesson I want to leave with you. You don't need to wait until the pain is gone to live fully. You just need to start living fully, and the pain will begin to fade like morning fog under sunlight. If this video helped you, don't keep it to yourself. Share it with a friend, a loved one, anyone quietly suffering from neck pain. And if you have a question, drop a comment. I'm here, always listening. Thank you for walking this path with me. Take care of your neck and the life that's waiting for you ahead. We'll meet again.